Hello, everyone. My name is Marilyn James, and today I'll be discussing my experience at Brighter Tomorrows for my final presentation. The mission of Brighter Tomorrows. As therapists, our goal is to help clients uncover their true potential. While we cannot change difficult situations in the past, we can work together to better understand and resolve challenges in the present and the future. um, by therapeutic approaches designed for individuals, couples, families to work towards healing and wholeness. Our core values include client welfare, professional development, social advocacy, justice, and the focus of Brighter Tomorrow counseling is to build towards strength, wholeness, healing, and self efficiency. And that is from their website, and I do have their website listed as well if you wanted to go back and look at it. They have all of their resources on there as well. Brighter Tomorrow Behavioral Health Services, their vision is to provide mental health services to all clients and promote excellence in clinical practice for counselors, interns, students, and trainees. Brighter Tomorrow focuses on practicing social advocacy. Population served. Brighter Tomorrow is located in Griffin, Georgia, and they're one of the largest counseling practices in Middle Georgia, and they see about 175 to 200 clients per week, and their services are for children, adolescents, and adults. Services provided. They do offer play therapy interventions, substance abuse, grief and loss counseling, parenting and co parenting classes, substance abuse, premarital, risk reduction, anger management. Some of these are court mandated. Family therapy, couples counseling, DUI, and suicide prevention. My experience at Brighter Tomorrows. My overall experience at Brighter Tomorrows was great. The clinicians provided the best support to mentor and guide me during the journey of interning. I felt supported and I never felt misguided. The experience was beneficial. One of the clinicians, Aaron, he always made me go out of my comfort zone to make me interact with clients. He would often allow me to take over sessions with children during play therapy, and I would basically take over the entire session. And it was very nerve wracking, but it was the way that I learned to kind of gain more confidence and just understand that it's a child, it's okay, it's gonna be fun. And I really just enjoyed play therapy. Although there was some really hard cases, I do feel like play therapy is very beneficial. Um, Interaction with supervisors. My interaction with supervisors were great. I did not have a bad experience with any faculty member. Shannon, the owner of Brighter Tomorrows, would call me weekly to make sure I was doing well, and if I had any questions about any cases, she was honestly the best. And if I had any questions, I could rely on her. And Christy was very accommodating with my limited schedule, and I felt like I could communicate with them effectively. I am majoring in social work when I go in for my master's, but if I were to go to clinical therapy, I would definitely do my internship with them because they have such a great program. But yeah. And my internship activities and skills developed. The skills I developed during my internship were immeasurable. The variation of age groups, cases, I encountered provided expertise. We did have to deal with some DCF cases, which was, very interesting to see as well. I did learn how to effectively communicate using active learning skills, um, active listening skills. Sorry, I learned how to effectively use techniques for play therapy. There are many interventions used. During therapy, and during my internship, I learned how to do the case management, documentation. Um, there is a lot of paperwork because these clinicians do get subpoenaed if there is a court case. So it's important to have everything documented, especially for insurance purposes as well. So there's progress notes that needs to be completed after every session. The intake notes are very important. The treatment plans, assessments, and the child, adolescent, and adult assessment scoring guide. So basically, that just kind of gives us an idea of where they are with, let's say, for instance, their anxiety or depression. There is different numbers. I believe it's from like 1 to 5. 5 is like the worst. And yeah, it's very interesting to see, especially when you see young children with a very low self-esteem. And my objectives, there are 9, but I'm just going to go over a few of them. Basically, enhancing ethical guidelines, proficiency in case management, enhanced knowledge of social issues, active listening skills, um, utilize effective methods of substance abuse and mental illnesses, which is super important. There is a weekly peer group, and for the month of November, we did it based off substance abuse and how to be the best support system for your client that is going through addiction. And it was just very informative, and I learned a lot, which was amazing. And strengthening my relationship with um, the clinicians and other faculty members. I did stay in touch with them. They're great. Um, yeah. And we did use simple practice for like our scheduling and to do no-show appointments and canceling appointments. But the clinicians use it as well to complete documentation, like I was saying, intake, discharging, completing assessments and treatment plans, and based off like all of the paperwork that they complete, and what the clinician observes during the session, and based off the assessment, we will look at the DSM-5 book as a tool to kind of get the proper diagnosis. There are a lot of rare cases as well, of like Tourette's or suicidal ideation, homicidal. That's all in there. That book is super informative. I learned a lot, but there are codes on there that are super beneficial for insurance purposes and just to have the proper diagnosis. So it's a great tool to look back on. And that is all. Thank you. If you have any questions, just let me know. I believe Brighter Tomorrows is a great facility if you are looking to get into therapy. There's so many programs. They also have great programs for autistic children as well, and abused children. It's just overall a great facility, and I do recommend it. Yeah, thank you.